Welcome to the Humble Hoof Podcast. My name is Alicia Harlov. This is a podcast for both horse owners and hoof care professionals, offering discussions into various philosophies on the health of the hoof and soundness of your horse. Please check us out on Facebook or at thehumblehoof.com.
Trying to choose the right supplements for the right horses often feels like a chore, and you have enough chores as it is. Fortunately, there's Equithrive, whose mission is to make this whole nutrition equation easier on you and much more beneficial to your horses. Equithrive's lineup of pelleted supplements are developed with care, backed by science, and a 100% satisfaction guarantee. Not to mention picky eater approved. Whether you need advanced joint care for your equine athlete, gut, or metabolic support, Equithrive is your one-stop shop for feed tub fortification. Do your horses and yourself a favor and visit equithrive.com. Use the promo code HumbleHoof and get 20% off your first order, plus free and fast shipping nationwide. Don't forget to use HumbleHoof, all one word, to get 20% off your first order at equithrive.com.
A special thank you to our wonderful sponsor, Cavallo. For our Humble Hoof listeners, they are offering 20% off their Cavallo Trek hoof boots using the coupon code HRN at checkout. The Trek is the world's most popular and versatile hoof boot and Cavallo's toughest trail boot, while also doubling as an option for therapy or rehab. The front closure system makes it easily adaptable to various hoof shapes, and TPU upper design allows for maximum strength while minimizing weight for the comfort and ease of movement for your horse. These are recommended by vets and trainers and also loved as transport boots by barrel racers, show jumpers, dressage riders, and everyone in between. Again, for 20% off a pair of Treks, use the code HRN at checkout at cavallo-inc.com. We are just about 6 weeks away from the Progressive Hoof Care Practitioners Conference in Chicago, Illinois, and I couldn't be more excited. It's going to be October 3rd through 6th, and we have some amazing speakers. Each of these speakers have been on the podcast before, so I thought I would do a compilation of some of their clips from previous episodes with them so you can get a sneak peek of what the conference may be like. And don't forget, you can register for the conference at progressivehoofcare.org/conference. And I hope to see you there. One of our headliners this year for the PHCP conference is Dr. David Rendle. And he is just an incredible speaker and has so much experience with endocrinopathic laminitis and the latest in research for metabolic cases. So Dr. Rendle is going to be talking about PPID and laminitis, equine obesity and management for weight loss, and also hyperinsulinemia and laminitis, and if we're able to make laminitis a thing of the past. So this little snippet from our last podcast episode together talks a bit about some of the latest medications that are being used for metabolic horses.
Yeah, so there seems to be a universal acceptance now. I think it was perhaps a bit controversial for a few years, maybe 10 or so years ago, but a universal acceptance now that insulin is driving the overwhelming majority of the laminitis cases that we see. I echo what you said at the beginning about this being a really great meeting and having Angie Van Epps and Chris Pollitt and others here and all talking about laminitis like a complete bunch of geeks, but we're all on the same page that the vast majority have been driven by laminitis. What we don't yet understand is quite how the laminitis develops as a consequence of high insulin concentrations. That is yet to be worked out. But the bottom line is if we can aggressively manage their insulin concentrations, we can improve and potentially prevent their laminitis. And so that's what I've been talking about the last couple of days, really, is managing obesity and then managing these hyperinsulinemia associated laminitis cases.
Yeah, and talking about the hyperinsulinemia, we were talking about, or you talked about this morning, the SGLT2 inhibitors, and, it's a fairly new medication, or for horses, I should say. Can you tell us what they are and the results that you're seeing on these really difficult, maybe refractory high insulin cases?
Yes, everyone's very excited about these drugs, and I think that's understandable, but we do need to urge a little bit of caution. We don't have a huge database behind their use at the moment, but everything that we've got is pointing towards them being a really exciting development in the management of hyperinsulinemia-associated laminitis, and you said it perfectly. So what do? They, in the normal run of things, the kidney would resorb glucose and prevent it being lost in urine. So everything would get, I say everything, lots of different molecules, including glucose, would get pushed out by the kidneys, and then the kidneys pull back the things that the body wants to retain, and glucose would be one of those things. So these drugs block the receptor that is responsible for pulling the glucose back into the bloodstream, which results in glucose being wasted in the urine. So we or the horse is excreting a lot of glucose in its urine, which means the amount of glucose in the blood is dropping, which means there's less of a stimulus for insulin to be produced by the pancreas. So they're lowering insulin levels, and they seem to do it very quickly and very effectively.
Celeste Lazaris is a body worker that does a lot with the thoracic sling and nerve release, and she's done some really cool things with horses, both in person and remotely. And she is going to be talking at this year's conference about the development of the body, the equine body, and its impact on hoof growth, as well as the equine nervous system and myofascial lines and their link to the hooves. So this little snippet from our podcast episode together a few years ago talks about how the body can affect the way the hooves wear and the common thing that we often see of some medial crushing in the front feet. Actually, one of the reasons that I reached out to you is, this idea of like heel crushing and getting underrun heels, or even just one heel that's crushing and the other one's really solid, is, it can be like maddening as a hoof care professional when we're trying to work through these issues and we're doing, all that we can, and we start to get these complexes, what are we doing wrong? And that's something that I was asking you is that, I have a case where this horse will crush the medial heel, and we've tried all different kinds of things. And I would love your input on that. And obviously we know that some of it can be hoof care related. Some of it can be the approach and the trim. But are there times when those crushed heels are coming from higher up, either in the hind end or the front or both? And maybe...
Totally.
Yeah, go on.
No, totally. So especially like the medial heel one, that's one of the most common ones that I see translating from the shoulder. So if we go back and we think about the fact that horses are grazing animals and how their bodies are designed, they are also prey animals. And so one of the main things, so if they don't have collarbone, they don't have a structure to kind of collapse and hold in all of their vital organs up in the front. So, their nerve lines, their arteries, their everything kind of runs in through that thoracic cavity. So I'll add into the thoracic sling muscles, I add in the infraspinatus and the supraspinatus, because we don't talk about these muscles at all. But so the infraspinatus is really, as we're kind of finding, is the muscle of independent abduction. And then the supraspinatus kicks on to that, and it's extension out of that abduction. So it only works when the infraspinatus is kicked on. And so we lose extension when we lose abduction. And I'm sure you've seen it, but like when a predator goes to take down a horse, they generally go for either their flanks or their necks. And so you've got two sets of muscles there that collapse and pull the horse in. So you've got your brachiosphalicus muscle, so the low neck muscle, seizes the whole neck up to kind of protect it from a predator. And it runs and it attaches to the front of the humerus. And so when it seizes up, it collapses the shoulders in. And so it kind of works if you imagine like a starting gate. If a horse is free and open and the brachiosphalicus is loose and the horse is just kind of going around in its play drive and playing and using big fancy movements, that starting gate is open. And the minute they kind of kick on and they start feeling unsafe, the starting gate closes and it seizes everything up. What happens when that, and that's generally how they will move through space. So if we don't catch that, this is like the number one issue with thoracic slings. And this is how it translates to feet. So if we don't take into account that that's how the horse will naturally move its body, we don't isolate and separate it in how we train our horses. And so the number one thing that horses will struggle with in training, whether it's circles and turning into like a motorcycling horse that's leaning in really heavily, or, spinal integrity where they get kind of like, spun up and they fishtail. There's so many different things that happen. And the root cause of it is that the horses lose the ability to abduct. So to draw the limb up and away from their body. So it's it's really, really difficult. So then we see horses, and I'm sure you've seen this when you watch horses walk. They like the number one chronic thing is tightrope walking. So horses will be walking and they cross one foot in front of the other.
Yeah.
And if they don't do it on the straight, they certainly will do it around a bend. So if you take a horse kind of loosely and you take it around a corner and they cross the outside limb in front of the inside limb, that's one of your biggest clue in that they don't have the correct musculature for abduction. It's not natural for them. And that's kind of like the golden egg of my training, I suppose, is that I've learned how to isolate and activate those muscles and how to isolate and activate the muscles around the brachial plexus so I can prevent nerve impingement. And so when you're able to, when you don't do that and the horses want to get kind of stuck in this adduction, what happens is they have to, even just standing a little bit, and then when they're walking, their weight will be loaded medially. They don't have the ability, because they don't have the musculature anymore, to kind of come upright, let alone out laterally. Every once in a while, you'll see lateral ones. That one I don't see super common, but I do see quite a bit of medial ones, and that's what it comes down to. And so my farrier and I will tag team on those cases a lot. And as soon as I can get those abductors fired on and balancing the horse out so that they can actually have full hoof stimulation throughout, instead of just being compressed to the inside, that goes away. But if he were to just do it on his own, he would just be, trying, and nothing would happen, because you can't change the way that the horse moves its body if it doesn't have the muscle to do it. Does that make sense?
Yeah. Yeah, definitely. And so you've been talking a lot about, this, hold on, let me get the right wording, because I just took the note down. Sorry. Oh my gosh, this is how my brain works, right? So you've been talking a lot about, this nerve release and working on these nerves. And can you maybe say like what that entails? I know that you can't obviously teach somebody over a podcast how to do it, and that's not really what I'm asking.
No.
More like, what does that look like? Like, what are you doing when you do that?
So when I'm doing manual nerve release, it's kind of like, if anybody's gotten, it's called structural integration massage therapy. So essentially what you're doing is you're going through and you're creating space. So one of the main things that happens with pinched nerves is it's not a problem with the nerve itself. It's a problem with the structures around it. So soft tissue around it, bony columns around it. Like, so people, if you're, I'm a big believer in chiro. And so a lot of the times my neck will need an adjustment. And if it goes out significantly, the way that the vertebrae will misalign, it'll affect the nerve. And so I'll get a pinched nerve, quote unquote. And I'm sure, like, there's a lot of people, I shouldn't say there's a lot of people, there's a lot of debate around whether or not to call it what it is. But for now, that's the vocabulary we have. So that's what we're using.
Jenny Hagen is an incredible veterinary podiatrist out of Europe that is going to be speaking at this year's conference as well. And she's going to be talking about the correlation between the locomotor system and body posture with the horse's gait and the hoof conformation, as well as talking about medial-lateral balance. So what can we look at to assess medial-lateral balance, and how can we affect it in our work? And this little snippet that you'll hear is from our last podcast episode together. And obviously you mentioned, you talk about like making a plan for that individual horse with the veterinarian. In one article that I read, you talked about, looking at the horse's stance and movement to make that plan. So what would you specifically look for to know whether a horse might benefit from having like a modification in their package that they have on?
So very first, when independent which disease or which injury I meet, I always ask, if I have new patients, so which status of rehabilitation do we have? So is it a very acute injury? Is it a chronic disorder? Is it already starting to be trained a little bit? Or is it to heal? So is it a chronic inflammation or a chronic injury which might not be able to recover again because podotrachlosis or arthrosis we can't really heal? Or is it something where we have success and we will end in a hopefully sound horse? And then, of course, you have to, dependent on the stage, you have to decide what benefits the best. So how severe, how strong can the modification be? So the more acute and the more severe a damage, the more aggressive I can create my modifications in the shoe, because the side effects might be there, but it's for a limited time usually. It's for healing, and the intended effects should at least cover the side effects or should be over the side effects. So that's the first thing I asked. And then, of course, it's depending also for the vet and the owner. So what is the, let's say, compliance and the management, the compliance of the owner and the management of the horse? Because if I would like to, I can make a perfect shoeing and I would like to relieve a structure, but if the management, for example, the keeping, the motion, the physiotherapist, the pain management, whatever, is not working, then I can do the perfect shoeing, but it's not helping. Then I have a perfect shoeing plan. I spoke with the farrier, but then it's just not possible to apply the shoe in a correct way because the horse is still working or walking on the pasture or in the field. Also, the financial limitations of the owner is sometimes interesting to have a very, let's say, sustainable shoeing plan. So it's not really helping if I make a huge, expensive shoeing for 1 or 2 times, and then the owner says, but now I can't afford it anymore, and then all the work is for nothing. So that's why you should also speak with the owner to make a very good plan. And since I'm also a manual therapist and trainer in rehabilitation, I always try to involve the vet or better people who are really experienced in training in the rehabilitation of horses, that they come out of the relief posture, that they have a physiological motion pattern again, so that you decrease the side effects of the, let's say, box rest or management of the horse. So there are so many different factors which should be considered to find a good solution for each horse, that it's not just the shoeing. It's always a teamwork, I would say.
Yeah. And is that like, if you're checking on the progress to see if you're happy with how it's going, is that looking at ultrasounds? Is it looking at MRIs? Is it looking at the horse's movement? Or how are you tracking their improvement?
Yeah. So, of course, for the initial injury or damage, the diagnostic imaging is a very, very good tool. So whatever you have or whatever is necessary, control X-rays or ultrasound should be done if it's possible. I mean, I'm also working in the field, and sometimes it's very hard to convince the owner to have more than 2 times imaging. But at least it should be done to make a diagnosis, and it should be done in the progress of healing so that you know what happens. Or at least if you say, okay, clinical wise, the horse is walking better, is looking sound, we would like to go to the next step, then you should have imaging again. And for me, more important is often the clinical symptoms or signs. So how does the horse move? How is it loading the limbs? How is, for example, the hoof angle? If you have chronic pain, usually the hoof angulation is uneven between the at least 4 limbs. How is it? How's the lameness? So how is the lameness developing? And I'm using often in these patients hoof beat. That's a system to measure the timings and the movement of the limbs during swing phase and stance phase. And we see some pattern where you could say, okay, now we are going more and more in the, let's say, physiological status again. It's developing, it's changing, the gait pattern is changing, and I'm satisfied. Or I see, okay, no, he's going back to a, let's say, more severe or more problematic situation. So the disease increase again. So this is also something I try to do as follow-up measurements, and that's not so expensive for the owner. So usually it's a mixture of everything. So I do the typical veterinary imaging. I do a typical lameness examination, but then I also do my manual therapist evaluation, so that I also check the muscle status and the function and range of motion of the segments of the body. And then if I can, I do my objective gait analysis to have an overview and see, and I have a monitoring of the patient. So it's statics and dynamics.
Yeah, and that sounds great. And I've seen my friend has a hoof beat unit, and I've seen how cool that is to monitor how they move and their biomechanics. So that's super interesting too.
I mean, it's not a substitution of the normal older versions of the objective lameness evaluation systems like equinosis or qualysis. So they are put on the head and the pelvis. Then you can track, of course, the degree of lameness, and also always in the background of your knowledge about lameness diagnostics. But the advantage to track the hoofs is a little bit that you see also the effect of your orthopedic treatments. And also of your training. So I have, for example, a mare with very uneven hoofs, with very uneven hoofs. And this mare had also a tendon injury indeed.
Another speaker that we have at the PHCP conference this year is Ida Hammer. And Ida is an incredible instructor that teaches trimming and hoof care courses. And she's going to be talking about why wear patterns matter and how prehab beats rehab, or how preventing issues is way easier than rehabbing issues. And also, she's going to talk a little bit about barefoot transition. So this next snippet is a little bit from our last podcast episode together. You have a saying that there is no such thing as all of the sudden unless it's trauma. Can you talk about that a little bit?
Yep, because that goes back to the whole horse thing. And this is what I get so wound up and excited about, because everybody, it's like, and I'm sure you hear it like constantly too. You'll be working on a horse and, you're seeing things that's not right. So the horse, maybe they're not traveling right. Maybe they're like some horses. This is a thing that makes me crazy, is there are some horses that are not lame, but they're not correct. So they're not limping. But when you watch them go, they're having to compensate in their body. And you'll see this a lot with sore-footed front feet soreness. Mm-hmm. And so what happens is for that horse not to limp and look like he's like the weak link, he's got to really lift himself up with his brachiocephalus muscles and like lift himself so that he can not be limping. So like it takes the weight off the front end a little bit. And you can watch that when they go, and you can actually, some of the classes that we actually do slow motion video and really zero in on that, because like a lot of people think their horse is just lazy, or it's just like it just doesn't want to go. And it really is just because that their feet are not comfortable, but they're not lame. So, and this happens where horses, this stuff is happening. You can look at a horse's body structure and see that this horse hasn't been traveling correctly for a long time, whether it be sore feet or bad riding or bad saddle fit. But then inevitably, the horse will eventually not be able to take it anymore, and then they will be limping. And then the statement is like, my horse all of a sudden came in lame. I'm like, no, not really. He's been telling you for a really long time he wasn't comfortable and you missed it. So there's really, unless it's trauma, there's no such thing as all of a sudden. I don't buy that.
Yeah. Yeah. My favorite one, not my favorite one, but when people are like, oh my goodness, they foundered out of nowhere. And I'm like, well, no,
yeah,
not really.
Yeah. I know. It's like, I'm like, I've only seen a handful of horses that like got laminitis out of nowhere. And one of those was, like I said, like the horse left home and never been away from home. And it went to a trainer. I'm like, and just the sheer stress of it. But other than that, like navicular disease, like, so like, and I can get, I pick on every discipline. So like on all the bad people that do the bad discipline things, not like the people that care. But, like you can watch a horse do what it's doing, and it's like, all of a sudden it's got navicular disease. I'm like, well, he's really been telling you that for about 10 years. And all of a sudden he's been foundered. No, but like he's had dietary issues in rings that, like, every time we talk about diet, you're like, my favorite one is like, there's really no grass out on that 10-acre field of like droughted grass. And I'm like, well, there's not much but a bunch of sugar cubes, but that's okay.
Yeah, right. Exactly. Another speaker that we have this year for the PHCP conference is Wendy Murdoch. And Wendy makes Surefoot pads and also does the Murdoch method. She is going to be talking about how we as hoof care providers can keep our bodies healthy and ease our own aches and pains, but also the connection between equine posture, balance, and behavior. And she talks a little bit with me here about ways we can assess risk of injury, or what we can look for risk of injury. And this is from our last podcast episode together as well. Yeah, and so I got into hoof care because my horse had soundness issues. And I think a lot of people get into, various aspects of rehab because they're dealing with a horse that has soundness issues. And so, obviously it would be nice to prevent that from getting to that point where, a horse has outright breakdown of their movement. I don't know if you have any, ideas of, subtle things to look for that might show that a horse is in some form of discomfort, and you need to intervene sooner rather than later before it becomes a bigger problem. Because I think a lot of people just wait until there's actually an issue that they're struggling with. Do you know what I mean?
Well, it's so difficult sometimes, because it's like your car, right? You hear a funky sound in your car, and so you take it into the repair shop and you go, I hear this funky sound. Can you check it out? And a perfect example, I had a clutch that was going bad in my truck, and I took it to the guy, and instead of checking the clutch, it sat there and got hail damaged when I was traveling. And he never fixed the clutch until it broke going 80 miles an hour on the highway with a 4-horse trailer with living quarters with 2 horses on going down the highway, and the clutch failed.
Oh my gosh.
Okay. Yeah, I know. We survived. I wasn't driving. The guy had to literally stand on the clutch to try and disengage it so we could get off. Unfortunately, there was a 24-hour Ford dealership because we were in North Dakota. But, so often the owner recognizes something's not quite right. And then they call the vet or the farrier, and they're like, you can't see it or feel it because it's really subtle. But you have to trust your gut. And Dr. Hillary Clayton always said that the first sign is a loss of suspension. So that's a problem with a gaited horse because there is no suspension. But with a 3-gaited horse, the first sign is loss of suspension. So you're like, my horse feels a little flat. That's the first sign. Horse owners typically know their horses really well, and they know what their horse feels like normally. And so they recognize something's not quite right, but the question is, what? And it's not always easy to figure out. I mean, where I live, Lyme disease is rampant. I mean, it's rampant. And so, limey horses can feel flat and dull or woody, or, and you're like, my horse doesn't feel right. And so then you kind of go to your vet, my horse doesn't feel right. Well, we'll do some flexions, we'll do this and that. But, it's the subtle, tiny little things, and we start to pick them up. And the thing is, it's really important to trust your gut. If you feel like your horse isn't right, most likely he's not right because you know your horse. But then it's a question of figuring it out. And, Surefoot can be helpful in that way too, because I've watched a lot of horses and I've put them on pads, and it's like, okay, if it's not getting better, or sometimes it actually gets worse. And I had one horse, we were doing the lameness locator with him, and the horse was lame, and we put him on pads, and the horse got worse, and the vet went, oh, soft tissue injury. So, it really helped him with his diagnostics. Yeah, I was like, whoa, that was fascinating. So, if you see like your horse standing on Surefoot pads and he has a regular pattern, and then one day he's like, nope, I don't want to do it. Oh, that's a big clue. That's a big clue. You'll see horses that I was doing a demo with one horse, and she had been my perfect demo horse for videos like a few months before. And then that day she was like, nope, I will not stand on your pads. I'm like, okay, you're another horse. But then the chiropractor came and went, oh yeah, she's out here and here, she needs an adjustment. And then she was fine again. So I'm not saying that Surefoot's going to tell you exactly what's going on, but if you know your horse, and if you're using Surefoot with your horse regularly and you see how they stand, and then one day it's like, that's not happening, or they want something else. It could be a positive thing that they've improved, and now, it depends on what you're seeing in front of you. Or it could be that you need to think, well, what happened? I overworked my horse yesterday. Oh yeah, I did that hill work, and today's not so comfy.
So those are just some very short snippets and sneak peeks of the speakers that you will hear at this year's PHCP conference in October 2024 in Chicago, Illinois. And I really hope to see you there. Again, you can register at progressivehoofcare.org/conference, and I hope that you can make it. I always say that I'm slightly more hoof obsessed than the average person, and chances are, if you're listening to a hoof care podcast, you are too. So we should probably be friends. Feel free to find me on Facebook or email me at thehumblehoof@gmail.com.